Hello, my name is Linda Way and I'm the Director of Emergency Services and Lifelight here at St. Mary's Medical Center in Duluth, Minnesota. I'm going to provide a tour for you today of the emergency department, and although this may not be the emergency department that you're visiting, there are many similarities wherever you go. And I'd just like to explain the common ones to you. First of all, you'll see that I'm standing at an information desk. And there will be either an information desk or it may say triage wherever you come in. Triage is a French term that really comes from a war scenario that means to sort. And what it does is to identify the priority of patients that need to be seen next. At triage, patients are identified according to what priority they need to be seen. The most severely injured or ill are taken directly to the back. We call it the back, and I think most places do, and that's where the patient care area is. The others go through an assessment, a brief assessment, and then are usually seen in the order in which they arrive. From triage, patients go to registration, and at registration they are given, they give their name and address and demographic data so we can have access to their previous medical records. Often from the registration area, patients wait a brief period of time, and sometimes in this day and age a little longer, in the waiting area before they're taken back to a treatment room. This is an example of an emergency department desk. The people that are here are our health unit coordinators, or the older term for them is ward secretary. But there's a clerical person here that will be your first contact. There may be nurses here, and often the physicians are based out of the emergency department desk. Emergency departments are a very fast-paced environment. We do not schedule appointments, and we typically are able to identify peaks and valleys of time, and we staff accordingly. The demand for emergency services can fluctuate in a matter of seconds or minutes. So as you come into an emergency department, know that it may be very, very busy. It may be relatively quiet. I would encourage you, wherever you are providing services, to stop at the main emergency desk first and check in and let them know that who you are and that you're here to see a client. Often you will not be present in the triage area. With the timing of things, you will have your first contact with the client when they are actually in the patient care area. This is an example of one of the resuscitation rooms in an emergency department. In any emergency department, there's going to be at least 2 and maybe 3 types of rooms. There is this large area full of equipment and monitors and resources that are needed for the critically ill and injured patient. And I recognize that there is a lot of activity that goes on in these rooms, and as you look at them, they're often real intimidating, and they're intimidating for the patients as well. They're a sterile environment, meaning it's not a real warm area, but it's really geared for resuscitation and saving lives and quick intervention. If you are with a client in one of these rooms, there will be a place for you, and communication is essential. Often when patients come in, we do not know their medications, their allergies, their past medical history, and this is vital information for us. So know that even though there may be a lot of people here and a lot of activity, once you've identified yourself, they will find a place for you to where you can interact with the patient, and it's all a part of the team, and it makes a big difference for the patient as well as for the staff that are caring for them. This is an example of an examination room in the emergency department. As you notice, it is probably just a little bit larger than your exam room in a clinic or physician's office. We do have equipment and supplies that we need to take care of the patients. And the other thing that I would like to point out that you're going to see in many new emergency departments is you will see computer equipment at the bedside. And the computer equipment allows access to the patient's electronic medical record. You will begin seeing this, you probably have already, in many of the emergency departments. As you come in, as I said earlier, just stop and check in at the ER desk or the information desk to find out the location of your patient and to just establish if they are critically ill or injured. That will help prepare you to what you will see when you arrive in the room. The one thing I'd like to say is that even though many of us have worked in emergency departments a long time, what you will find is there isn't a lot of turnover in emergency departments. But even for us, sometimes things bother us. So if something is bothering you, or if it is, very small percentages of patients are critically ill or injured, but if something's bothering you, just excuse yourself for a minute. Often, if it's a warm situation, the heat with all those people in the room can make you feel a little bit ill, and just step outside for a minute, kind of catch your breath and cool down a little bit, and I think you'll find that you feel better. The other thing I can tell you from my years of experience is that if you know you're coming into a situation where, where somebody is really sick or injured, I would encourage you, even though time is important, to take a minute to eat something before you arrive. And the reason is, often, in my experience, if people have gotten sick when they're here on clinicals or experiences, it's because they haven't eaten anything and they've come into this scenario, and it makes it a lot more difficult. So just know that this happens, it's normal. Sometimes things bother us as well. I myself personally have a real hard time watching people get their blood drawn. I don't like it, and yet I don't have any problem starting IVs on people. It's just that different things bother different people in different ways, and you need to know yourself and be aware of that. The emergency department is a real strong team, and probably stronger than many actually, of the units in the house. And the reason is because we work together under real difficult situations. And if you use the term, if you want to use it, we bond with each other. We're like a family. We help each other out, and it's all of us working together that get us through some of these really busy shifts. It's a great place to work. I think emergency departments provide a real service to the community. We are the safety net. We are the access point for a lot of patients who can't or don't receive care in other environments. We're here day and night, and we are here to serve our patients.